Hello, friends. I'm Jolene, a doctoral-prepared, dual board-certified pediatric nurse practitioner, and I'm so glad you're here today. Today, I want to talk about what this past week represented for me and what it really takes to work those long shifts, those long nights and long days as pediatric nurse practitioners at the bedside, as nurses at the bedside, the respiratory therapists that assist us, the techs that are there with us, everyone that is there on the team, the physicians, anyone that's there during the night, during the day. Let's talk about what it really, really takes in critical care. This past week, I came off back to back to back nights. And yes, I worked 4 straight 12-hour shifts in a row. And as we all know, it's never you're done at the end of your shift. As a nurse practitioner, you're done when what needs that your patient have are done. And sometimes that extends well beyond your shift. And you do what's needed to take care of that patient and that family. So these long nights were the kind where every patient is critical, where every decision that you do, every decision that you make matters, and where there's no room to step away. It's the kind of nights where you're fully in it. You're managing airways, you're adjusting support, you're thinking 3 steps ahead of everyone else, watching every number, every change, and just holding the line for a child whose body is struggling to do what it normally does without effort. And it takes everything. Your knowledge, your training, your experience, but also your endurance, your presence. And that matters more than anything. And how you show up for your patient, your families, your nursing staff, the physicians, any of the collaborative teams that work with us. Your presence as a pediatric NP or as a nurse or whatever role that you're in truly matters and makes a difference for that child and family. And so it's really important that you have the ability to stay steady when everything around you feels uncertain. And we know that's hard to do, but it's so important, especially as an advanced practice provider and in those roles. That's what we have to do. I always think about it like this. If you have a leader who is put together, can keep their composure, even in intense situations, then everyone around them, that seems to trickle out and around to every single person in that environment. Not only to your colleagues, but to your families and your patients. Everyone notices that. Everyone, their level of intensity is just able to drop to a level that is manageable for everyone involved. Now, I will tell you, I've been in this business for a very long time. I've been in healthcare for almost 30 years, and I can tell you, I've been in situations where there have been people who are not calm, who are not steady, and their presence escalates those around them. So I think it's very important to understand and know that we keep that calm, steady presence even when it doesn't feel calm and steady inside. It's so, so important for everyone involved because there are just moments, especially when you work night shift, when your body is just done and you've been on for multiple shifts, when there is exhaustion that is so deep, you feel it in your bones, in your thoughts, and in the quiet second where you realize you haven't stopped moving, And for many of us, you haven't went to the restroom for 12 hours. You haven't stopped thinking. You haven't even taken a full breath for hours on end. And still, you're expected to be sharp, to be precise, and to be right. Because in our line of work, the margin for error is not there. And we all know it. And in those moments, you could stop and you could step back. You could say, I need a moment. But you don't, because they need you. And that's why we're there. And that's the part that people who have never done this role, never been a nurse, never been a respiratory therapist, never been an advanced practice provider or a physician or someone at the bedside in critical care, that's the part that people don't always see. It's the quiet decision to keep going. So you take a breath, you center yourself again, and you bring your focus right back to what's happening. You steady your hands, your thoughts, and your presence, and you step forward again and again and again. Even when you're tired, because they need you. And I was lacing up my shoes, putting on my compression stockings because, goodness, after a couple of nights, I've got to have something. Those that know because your legs get so tired. Grabbing my stethoscope, my water bottle, and getting ready to go back in again. Not because it's easy, because it's not, but because it matters. And because they matter. Those children and those families, they matter. And inside those rooms, it's everything. It's the intensity. It's the responsibility. The awareness that what you do in those moments can change the course of a child's life. And in critical care, that is truly, truly important. Many things can change in just a matter of seconds for children. Doesn't take much. And we are there to hold that line and to say, okay, this isn't working. Let's do something else. We are here. We're standing here. We're standing watch. And we're making sure that everything's going to be okay. And it's the constant balance of urgency and control. Moving quickly, but thinking clearly and critically thinking about what's happening with every single child and everything that is happening in that environment. Acting decisively while holding space for what's unfolding. And for those of us who've been doing this for a while, and especially advanced practice, knowing that you are thinking 3 steps ahead. You're not just looking at one area of the picture. You're taking a step back and looking at the whole room and what is happening with that child. You're taking it all in, the vital signs, what the patient is doing, how they're presenting, how their lungs sound, how their heart sounds. Everything that's going on, you are paying attention to. What is their urine output? What is their intake? What is going on with this child? What has changed? All of those things, you're taking that in and processing it very, very quickly so you understand and can make a diagnosis and treatment regimen that will be effective for that child. Because that's why we're there. We're there to hold that line and make sure that they're okay. And you carry that with steadiness, with clarity, and with purpose, even when you're tired, But in the middle of all of that, there are moments that matter just as much. The quiet ones, the human ones, the moments with families that we have the honor of being a part of. Because no matter how critical it is, there's a parent sitting there trying to understand what's happening to their child, trying to make sense of words they have never even heard before, and trying to hold it all together when everything inside them is shaking. And that matters. So you slow down, even when everything in you is tired. You choose to slow down. You take the time to get the interpreter on your phone, on the iPad, in person if possible, because they truly deserve to understand what's happening with their child. Not just hear pieces and not just nod without clarity, but to actually know what's going on, to feel included and to feel seen. You explain things in a way that makes sense, not in medical terms, but in human terms. Common sense, right? You break it down, you pause, and you check for understanding. Then you give them space to ask questions that they may not even know how to ask. And then you sit down on the couch beside them or in the chair at the bedside. You lower yourself to their level, not standing over them, not speaking down to them, but meeting them where they are, eye to eye, human to human. Because connection, it matters more than you know. I'll never forget the time that I spent over an hour on my knees in a hospital room in the middle of the night, discussing with family what was going on with their child, making sure that they understood, had the time to ask the questions that they wanted, and then getting up off that concrete floor was not so easy as it used to be. There were nowhere else to sit because there was a lot of people in the room, and they needed their family there for what was happening with their child. So I needed to be able to get down to a level where they could hear, they could see the connection, and know that I was trying to really understand and help them understand what was happening with their child. Because in those moments, how you make someone feel, how safe they feel, how heard they feel is just as important as what you do clinically. We're not just treating patients. We're holding families through moments they will never, ever forget. Moments that will stay with them for the rest of their lives. And we carry that. We carry the responsibility, the decisions, and the weight of those nights. The faces, the conversations, and the quiet moments after everything settles. Long after the shift ends. And yet, we come back. Not because we don't feel the exhaustion, but because we understand the calling. Because we know what it means to be there when it matters most. Because this isn't just what we do, it's who we are in the moments that matter most. And maybe that's why Having a place to release what we carry, to write it, to process it, to put words to what we hold inside matters more than what people realize. Because we were never meant to hold all of it alone. So every provider showing up, even when you're tired, even when your body is asking for rest, and you still choose to lead, to care, to be present, to step forward again and again. I see you. I understand you. And what you do matters each and every day, more than words can fully capture. And remember, the world needs your compassion, your courage, and your light, now more than ever. And as always, until next time, keep shining.